Welcome back. In today's video, we'll be discussing comorbidity, which refers to the presence of two or more disorders occurring simultaneously. Specifically, we'll explore how depression often coexists with other mental health or physical health conditions. Recognizing comorbidities is crucial for providing comprehensive care, as untreated or poorly managed co-occurring conditions can complicate depression treatment and recovery. Let's start by talking about mental health comorbidities. Anxiety disorders and depression frequently occur together. In fact, up to 50% of people with depression will also experience an anxiety disorder at some point in their lives. These two conditions are closely linked, as the emotional distress of depression can amplify the symptoms of anxiety, and the overwhelming worry and fear associated with anxiety can contribute to feelings of hopelessness and sadness in depression. The relationship between depression and anxiety is often described as a vicious cycle. For example, someone with depression may feel hopeless about their future, which can trigger excessive worrying and nervousness about everything from relationships to health. On the flip side, an individual struggling with anxiety might experience physical tension and emotional distress, which can worsen their feelings of sadness, leading to deeper depression. These two disorders often amplify each other, making it harder for individuals to manage either one. That's why treatment for both conditions is important. Cognitive behavioral therapy, CBT, medications and stress management techniques are commonly used to address both anxiety and depression. Reflection questions. How do you think depression and anxiety feed into each other, making it more difficult to treat both conditions? What types of treatment approaches do you think would work best for someone dealing with both depression and anxiety? Next, let's explore comorbidities involving substance abuse. Depression and substance abuse often go hand in hand. People with depression may turn to alcohol or drugs as a way to self-medicate and numb their emotional pain. While these substances might temporarily alleviate some symptoms of depression, they often worsen the condition in the long run. For example, alcohol, a common coping mechanism, is a depressant, meaning it can increase feelings of sadness and hopelessness once the effects wear off. People who abuse substances might also experience more severe sleep disturbances, mood swings, and impaired judgment, which makes it even harder to manage their depression effectively. When depression and substance abuse coexist, it creates a complicated treatment scenario. The individual may be reluctant to seek help for either condition due to feelings of shame or guilt. Additionally, traditional depression treatments, like medication or therapy, may not be as effective until the substance abuse is addressed. Integrated treatment programs that address both depression and substance abuse simultaneously are often recommended in these cases, helping individuals break the cycle of self-medication and get the support they need for both disorders. Reflection questions. Why do you think depression and substance abuse are so commonly linked? How can treatment be adjusted to address both depression and substance abuse simultaneously? Now let's talk about chronic physical health conditions and depression. People with chronic illnesses like heart disease, diabetes, arthritis, and chronic pain are at an increased risk of developing depression. The biological connection between these conditions and depression is well documented. For example, chronic pain can lead to a constant sense of discomfort, which can trigger feelings of hopelessness and helplessness, common symptoms of depression. Chronic illnesses often require long-term management and can cause significant lifestyle changes. This ongoing struggle can lead to emotional distress, as individuals may feel overwhelmed or frustrated by their health condition. In turn, depression can worsen physical symptoms like pain, fatigue, and difficulty sleeping, creating a cycle where depression makes it harder to manage the chronic condition, and the chronic condition worsens the depression. For example, individuals with diabetes who experience depression might struggle to adhere to their medication or make necessary lifestyle changes, such as exercise or healthy eating. Similarly, someone with chronic pain from conditions like fibromyalgia or arthritis may experience a decline in mental health, which leads to further physical limitations and emotional isolation. Recognizing chronic conditions as risk factors for depression is essential, as it allows for more integrated care. Treating depression alongside chronic illnesses can improve both mental and physical health outcomes. Effective treatment might include pain management, antidepressant medication, and psychotherapy, aimed at helping the individual manage both the physical and emotional aspects of their condition. Reflection questions. How might chronic physical health conditions like diabetes or heart disease increase the risk of depression? How do you think depression affects someone's ability to manage their physical health condition effectively? Finally, let's consider depression and its relationship with sleep disorders. Sleep disturbances, whether in the form of insomnia or hypersomnia, sleeping too much, are common in people with depression. The connection between sleep and depression is complex. Poor sleep can worsen depression, and depression can disrupt sleep patterns. People with depression may find it hard to fall asleep, stay asleep, or get restful sleep, which leads to fatigue and irritability. In turn, the exhaustion caused by sleep disturbances makes it harder to cope with emotional distress, creating a vicious cycle. Conversely, some people with depression may sleep excessively to escape their negative emotions, but even with more sleep, they often wake up feeling unrefreshed and fatigued. It's essential to treat sleep disorders in people with depression, as improved sleep can help alleviate depressive symptoms and improve overall functioning. Cognitive behavioral therapy for insomnia, CBTI, is one common method used to treat sleep problems in individuals with depression, helping to break the cycle of poor sleep and worsening depression. Reflection questions. How do sleep disturbances impact the overall experience of depression? Why do you think improving sleep quality can have such a significant effect on managing depression? In summary, depression often coexists with other mental health disorders, such as anxiety and substance abuse, as well as chronic physical conditions like heart disease or chronic pain. These comorbid conditions can make it harder to diagnose and treat depression effectively, but recognizing the overlap allows for more comprehensive treatment. By addressing both depression and the co-occurring conditions simultaneously, we can help individuals improve their quality of life and enhance their overall well-being. In our next video, we'll explore how depression is diagnosed using standardized criteria, including the ICD-10/11 and MH-GAP guidelines. These diagnostic frameworks provide the structure needed for accurate assessment and treatment. Let's keep it going, and I'll see you in the next one.